Hello. So today I had an appointment today with my surgeon and nurse practitioner in Rochester, and I also had an ultrasound today on my liver, spleen, kidneys, all that lovely, lovely stuff. So I'm going to share with you my appointment from today. Everything seems to be going well except for one thing. Um, I know I mentioned before that I go through some hiccups, with the journey, and journeys are always a mess. Yeah, this one is kind of a little doozy. Um, Throughout the healing process, I mean, the incision is actually healed, so it actually looks really good. They said that I look amazing for only being 39 days post-op. I'm up, I'm walking, I'm talking, I'm eating, I'm using the bathroom. Everything seems to be normal, working order right now, so the liver is doing her job. Um, Here's the kicker: I have developed a hernia, and it's not painful right now, but they did tell me some things that I need to look out for, like if the area starts to look purple, or if I have a hard time defecating, or basically being constipated. If that is the case, that is considered a medical emergency, and I would have to go to the ER and have surgery right away to remove the hernia. So he is hoping that I don't need the surgery right now. Um, he goes, eventually I am going to need it. It just depends when I'm going to need it. It could be a few months from now. It could be 6 months from now. It could be a year from now. But he is hoping that, my immunosuppressants will actually, my body will have a little bit more time to get used to the medication before even thinking about doing a very serious surgery like that. Um, there's like many ways that they can do a surgery. It could be um, where they have to put a great big cut in me, and in order to get to the hernia to get it out. There's a way they could do laparoscopically if it's small enough. Sometimes if there is a big hole there, because that's basically what it is a hernia as a hole, and you don't want that to get bigger because then that can cause like more damage to your body, um, especially with your intestines. um, so that, yeah, definitely don't want that to happen. um, so if it's bad enough, they would have to put a mesh in to kind of help it heal. I'm thinking that's probably what they're going to have to do with me. um, as of right now, there's really no surgery scheduled for that. They would, they do want me to have a CT imaging done just to see what, how bad it is, and if I need to go in right away and have it done. So right now I'm kind of a sitting duck, just sitting here. But, like I said, the good news is I'm not really feeling any pain. So, you know, maybe right now is not really needed. But they did give me something that's called, it's like a wrap. So it's called an abdominal binder. So I will show you what it looks like. No, I'm not flashing you. Just chill. So this is what it looks like. Okay. It's just a wrap, and if it's over the spot where the hernia was at, so it was like a big bulge that was just sitting over the top of the incision. So it's to keep it from getting bigger, basically. They gave me two. So if one's dirty, needs to be washed, I can wear the other one. I basically have to wear it at all times right now. So um, it's not that bad. I did drive today. I drove up there with my daughter in the car. It was a little much for me because it was like an hour and a half trip. But she drove home, and then I had to go back to Batavia for my ultrasound. So I drove there, but that was like only a 30-minute drive. So I actually did okay with that. Wasn't that bad. And I did lose more weight. So starting off in my journey from when I found out about the liver issues, which was about 10 years ago this October. Okay. October, November timeframe. I was about over 300 pounds at that time, mind you. And my weight always fluctuated in between the 280s, 300s, sometimes it was 310, just depending on what the day is. And I can remember exercising, trying to eat the right foods constantly, and nothing was changing. And then I would get flustered because nothing was changing. And then having doctors tell me, well, you need to lose weight. It's like, I'm trying. What do you want me to do? It's like, do voodoo or something? I mean, I couldn't figure it out for the life of me what the hell was wrong and why I couldn't lose the weight. And it was all that fluid that was just sitting on my body. So after the transplant, I did swell up a little bit, but that was due to surgery. Now, a lot of that water weight is just like coming off. So basically, I went from the 300s down to 227 pounds. That's what the weight that I'm at as of today. 227 pounds. Do you realize how long it's been since I've been down to that size? I was a mom living in Ohio with 2 kids. My daughters were 2 and 4 at that time. 2 and 4. They're now 19 and 21 years old. That was the last time I was ever down that weight. And ever since 2010, I just kept ballooning up. And it's like no matter how much I would lose, which would be just a tiny bit, I gained so much more back. And then I would get flustered because it's like, what am I supposed to do? So I actually tried on a pair of pants that I held on to from 2009, 2010. So this one is a time capsule. Let me get up here. I have got my little chair that I sit. So this is a fashion bug pair of jeans, size 22s. 22s. And they're a little big. I went to a thrift store yesterday. I found jeans that still had the original tags on them. Size 20s. They fit. I went from 28 30s to 26 to 24, bypassed the 22s, and now I'm down to a 20. And I'm not done losing weight yet. I still have water weight still sitting on my body, but it's coming off. And every week I'm losing 10 plus pounds just coming off. I'm not trying to lose weight. It's just all that crap is just finally coming off of me, and my body can actually breathe. So it's a good feeling. And I'm very happy about that. It kind of makes me sick that I had all that crap just swirling around in my body for 16 to 20 years. It's terrible. That's what liver disease will do to you. It messes with everything in your body. It backs you up so bad. That's why it's important. If something isn't right, always check with your doctors, because there could be something underlying that you may not be aware of. And the sooner you know what's going on with your body, the better. And if you have a great team that actually will work with you and trying to figure out what's going on with you, that's the icing on the cake. You know, the closer that you can possibly get to feeling better. Possibly. You know, sometimes, certain things just, it could be more than one problem. is the issue, and that's unfortunately that's what happened to me. With I knew about the liver issues, but then on top of that, 3 years ago, I had the thyroid cancer, and I had to get my thyroid removed, all of it but the left parathyroid gland. So that's for my calcium. Calcium is good right now. So, um, yeah, I got whammied. I got whammied. And a lot of things have suffered in my life. For the longest time, I put myself on the back burner. Between being a mom and being a wife, I dealt with a lot of stuff. And it was so stressful. It just so much to the point where I didn't even know who I was anymore. Looking in the mirror, I did not even recognize myself. And I found myself not acting like myself anymore. So, um, since I've had the surgery, I've starting to become more of myself every day, which is great. I thrive on that. It just now I have to start making some changes, um, in order to continue to be happy. And that's another journey that unfortunately I have to take. So, um, other than that, I'm fine. My dog, my girl dog, she's laying on my bed. I'm sitting in my chair. It's kind of low, but it does. It'll do. um, she has been literally up my butt since I've been home. She will not let me out of her sight. If I have to go to my doctor appointments, she is not a happy camper because she would rather be there with me. Um, it's just, I don't know what I would do without her. I don't know what I would do without my dog Buddy. And I call them the troublemakers. But in reality, they're beagles, but they're actually very well behaved. They don't tear up my furniture unless you count releasing fur on my bed or the couch as destroying furniture. They don't tear up furniture, they don't tear up clothes. They're very laid back for beagles. And I do hear them howl. Buddy actually howls because he's a purebred. Brittney is a mix, so she doesn't howl, she barks. And I couldn't ask for better dogs. I really couldn't. And when their time comes, I don't know what I'm gonna do. I'm gonna be a complete mess. And I mean, there's no other dog that could ever replace them. Um, I consider them diamonds in the rough. They came from pretty bad situations. Brittney was in a shelter. She was close to being euthanized, and she was only a puppy. Um, my stepdad got her for the girls, and we took her when we moved to New York, and she ended up being my dog. And she's 14 now. She sleeps in my bed every night. It's just me and her. Um, she eats pretty good for a dog. Um, she hates baths. She hates getting her nails trimmed. She hates getting her teeth brushed. She loves to be smelly. I don't understand it. How can a girl dog love to be so smelly? I'm a girl and I don't even like to be smelly. Buddy, on the other hand, he's a little bit more prissy. And he likes to eat salads. Yes, yes, he likes to eat salads. He throws a fit if I don't pay the cheese tax or any food tax for that matter. Um, he's so sweet. And he was my college dog. So when I went to school to be a vet tech, he was one of the dogs in the lab that they used for testing for, well, not testing, but like the students use them for, how to do basic examinations. So, yeah. And he was in a cage with another male dog, and they're like, well, he's being aggressive, he's a little aggressive towards the other dog. I'm thinking, you put two male dogs that still have their testicles and testosterone in there, yeah, they're going to get a little aggressive. They're supposed to be in their own cage. And no, you had to lock them in two of them? No. Two of them in one? No, absolutely not. So he actually has spent his retirement with us since 2016. He loves his own bed. He likes his space. He loves his privacy. That's just how he is. He is now 11 and living the good life. He's been living the good life for a long time. And that ain't never going to change. Yeah. I don't know what I would do without him, to be honest. They have been my rock ever since I've been really sick. And Loki, I can't forget Loki. He's the cat, but he's like a male nurse. He knows when I don't feel well, and he activates his purring powers to make me feel better. But I have to watch it with him because he uses the bathroom in the litter box, and since I've had the surgery, I have to be a little extra careful around the cats. I can have cats, I just have to be extra careful, and especially with them using the litter box. Cats can actually give off something called toxoplasmosis. So any women that have been pregnant have heard that from their doctors, that can't clean out the litter box because of that toxin. It's the same for liver or any transplant patient for that matter, because we're on immunosuppressants. So we can't fight off disease as well as somebody who has not had a transplant and has a great immune system. Hopefully someday they'll come up with something to where, there's an injection that can be given to where it kind of overrides the system to where we don't have to take immunosuppressants anymore, and we can actually build our immune system back up again. Still have to follow the rules of the transplant though, not eating certain foods and washing your hands and just being extra careful. But yeah, I mean, if something like that ever happens, I volunteer as tribute, because I mean, as much as I love being alive, the medications are a little bit of a downer, okay? I will admit that, and it's a lot of them that I have to take right now. Over time, the dosages and certain medications will drop, but for right now, I'm on a lot of them. And actually, just last Monday, they took me off of one of the medications. That was an antifungal medication called diflucan. Is the name brand of it. It's difluconazole. So any like fungal infection, it fights it off, basically. And since the 20th of July, I have not needed to take it. So now it's being careful. I have to get vaccines. I can't do live vaccines because again, no immune system. Sorry. So I will be getting my flu vaccine. I get that every year, so that's nothing new. And update on COVID vaccine. Again, it's nothing new. I do that every year. I may have to add another one to the mix. It's like for shingles, because I did have chickenpox when I was a kid. So I may have to get that. That is part of it. I also have to see a dermatologist because transplant patients are 65 times more likely to develop skin cancer, and skin cancer runs on my mother's side of the family. So, yeah, we're a ball of fun right now. Yeah, it's a lot. It's a lot to go through, and it's not all sunshine and roses. Now, I have my good days, which is a lot of good days. I'm up, I'm happy, I feel great, I have more energy, I could do a little more. And then there are days where I just feel like a Debbie Downer, and that's normal. I'm still trying to navigate through this. I am no expert and I'm not perfect at it, and I'm not going to be. There are things that I don't know, and if it's something that pertains to my transplant that I don't feel comfortable with, or doing or taking or whatever, I always call my transplant team before I do anything, and thank God for them, because they actually guide me into what is approved, what is not approved. um, I'm now in the process of switching to a different PCP, which PCP stands for primary care provider, because my my physician, my current physician, is not really wanting to work with my transplant team. I have high blood pressure right now, so I have to be on the blood pressure medicine to kind of keep it down so that I don't end up having a heart attack or a stroke or both. And if I have one or both and it kills me, then what was the whole point of me getting the transplant? That was a waste of time. So anyway, um, my home health nurse came out last week, and she checked my blood pressure, and it was 162 over 100. Very high. And before then, I reached out to him and told him I was going to need, blood pressure medication. And he wanted to prescribe a medication called ibuprofen. And with me just being out of having a transplant, that can actually do some pretty nasty side effects. It can increase my potassium, it can mess with my kidneys, to where they don't work anymore, and I would need dialysis. Yeah, very scary side effects. And I felt uneasy with him prescribing that for me. So I actually reached out to my transplant team, and they said, absolutely not. You just had the transplant not that long ago. That's going to do more damage to your body than good. She goes, it'd be one thing if you were like a couple years out from having, like after having the surgery and your potassium was low, then yeah, we would say that would be fine for you to take. But what they recommended for me was a Norvac or um, La, Labetalol, which is what I'm on now. So because I told him that, he actually sat there and like, well, because they seem to know what's best for you, maybe I should let them handle it. No, sir, you're supposed to be handling that. You originally prescribed the one medication I was on before I had my surgery. It's like they deal with the liver stuff, you deal with everything else. And I would think with him being a primary care physician, he would know that. But it's like he was just like passing the buck off to them. And it was not okay. And my coordinator was like trying to reach out to his office like every single day. And there was notes on there on my portal that she reached out to them, and they didn't get a hold of me. They didn't call me. So when my home health nurse came out and noticed that my blood pressure was high, she actually got on the phone with my primary care physician's office and basically ripped them a new butt and sent me to the ER, which luckily I live 5 minutes away from my local one. So I had Chris take me, and I was there for 8 hours, and my blood pressure was high. My magnesium was really low, so they gave me magnesium, monitored me, and sent me home. I finally had an appointment with him, or with my primary care physician, on that Friday, and it was just like making excuses, and I was not very happy about that. I'm like, no. I already made an appointment with a new one. But the problem is I can't get in to see her until like the end of September. So I went ahead and made that appointment. And after that appointment, if I feel that she's going to do a good job and, be willing to work with my team, on, medications or stuff like that, or any questions that she would have, then she's going to be my new primary care physician, and my current one is going to be done. I don't do well with male doctors. Um, I've been dismissed by a lot of them when I was younger, and them making me feel like I was wasting their time. So usually I prefer female doctors because I feel more comfortable, and that's just how I am. Everybody's got their own preference. Mine is based on experience and what I've dealt with. Um, so it's, and he's making excuses and then sitting there saying, well, I guess if they want me to do something, I'll do it. I'm thinking that is not I'm thinking that's not reassuring. I ended up in the hospital on your watch. You played with my health, sir. I'm not a happy camper. And he did. He played with my health, and I can't have that. Especially since I had this transplant. I am not just some person coming off of the street that's like an average, you know, woman that has like no health problems whatsoever. I'm considered a special case now. So therefore, my care has to be specialized, whether they like it or not. And that is not my fault. All of that happened to me was not my fault. And, it just happens. And if somebody makes you feel like it's your fault when it's something that you had no control over, my dog is having a dream right now. Don't mind her. She's chasing after something right now. But anyway, anybody makes you feel like that and something that's out of your control, no, absolutely not. That is not okay by any standards, by any means. Okay. I am letting you know that. I had to find out the hard way. And I see that trend continuing for a while. I'm to the point where, yes, I feel better. Yes, I'm getting back to my old self, but my old self is also not putting up with shit anymore either. And I think that might be part of being in my 40s. I don't know. But it's irritating when that happens to you. Anyway, enough about that rant. Um, Everybody else seems to be doing fine. I've got two daughters that are starting college August 31st, and they're going to the same college. So my oldest is going back to school, and she's going to finish her degree that she started back in 2023. And my youngest, she's been in college for over a year now, so this is going to be her second year that she's going into. And so I've got two kids in college, and I always hoped that they would both go to college. And I hope they continue to do well. So, I've got two college degrees, and only one of them I could really use right now. My first one, my veterinary technology degree, I can no longer use because of my health. Which sucks because I loved that field. I love learning about stuff. And there's always new things that are constantly happening in that field that you thought that would never be possible for animals. So, yeah, I'm a little bummed out about that. That's like $25,000 basically down the drain. My medical billing and coding degree was a lot less than that. But the medical billing and coding, I can work from home if I want to. I can actually go into other careers with that degree, and I'm seeing that as a possibility as well. Yeah, there's going to be a lot of new changes that are going to be happening within the next several months, for me, and I'm looking forward to it, but I'm also kind of sad about it at the same time. So, um, just because I'm nervous and I don't know what to expect. So, but on other news, I had mentioned, in my posts, about naming my liver. Now, traditionally, when you get a transplant, if you give it a name, it's supposed to bring you good luck. So I named my liver after somebody who was like very, very close to me. And it was actually my grandmother. My grandmother died from liver failure June 4th of 2011. Um, this year has been like really, really weird. But let me backtrack. So my mom actually had a liver transplant 10 years after she passed away, in 2021. Actually, September of 2021. Okay. My uncle, her brother, had his transplant in October of 2024. And then 2 years later, or year and a half, or whatever you want to call it, I got mine. But I got mine on June 21st of 2026. Um, so my grandmother passed away 15 years ago in June. I got my transplant in June. And it also landed on my uncle's birthday and my cousin's birthday. It's been a weird year. Beginning of June, there were some uh, passings or deaths that people I knew. Um, and that was really hard. That was really, really hard. Um, I was a mess, um, because it scares me. Um, and it happened in threes. So I knew when something happens in threes, something big is going to happen. I just didn't realize that the big thing that was going to happen was my transplant, uh, which took me by surprise. Um, but, you know, I mean, it's, I'm still saddened by it, you know. It's no fun to deal with. It, for those people that lost their loved ones, I am so sorry. Um, it's never easy when you lose somebody, especially somebody that you're really close with, whether it be a spouse, whether it be your grandparents, uh, parents, aunts, uncles, cousins. Yeah, it's no fun. But I am thankful that I'm still here because I didn't think I was going to be here. And like I was telling everybody, I was preparing for the worst. It's like, expect the best, prepare for the worst. I was trying to live my life as much as I could. I was going to go to my high school reunion, and I had to miss that because of my transplant. That's okay. I'm not sad about that. you know. Um, they can all see me like at our 30-year reunion. I'm sure I'll still be kicking by then. So, hello, Pup Pup. But yeah, there's a lot of changes going on. Currently dealing with a hiccup. Um, when I do have a hernia surgery, I will definitely let you guys know. But as of right now, no surgery is scheduled, so it should be okay. As long as I wear my binder, I should be just fine. And yeah, still losing weight. Um, yeah, and I'm starting to get like cabin fever, so I'm going to be starting to get out of the house a little bit more now and go out and have fun with my friends. So, yes, I have friends up here. Don't give me that. So, yeah, it's about time. It's about time for me to get out there, but I will do it safely and have a blast. So, yeah, that's my life right now. um, one day at a time. It's all I can do. And just make every day count. You don't know when something's going to happen. Just live each day like you're not going to be here tomorrow, you know? But try to make wise decisions if you can. If you want to go out and have fun, live life, live life. Just don't be dumb about it, okay? That's just my only advice with that. If you can call it advice. Nah, don't even do that. Live your life the way you want to live it. That's what I am trying to do, but I'm trying to do it safely so that I can be here for another, heaven forbid, 20, 30, 40, 50, 60 years. If I make it till I'm 100 and a little old lady and I still look good, job well done. That means my time was not up yet. So, but, hi? She's just looking at me like, what you doing? Hey, baby. I love being a Beagle mom. I can't help it. Do you want to say hi, Brittney? Yeah, say hi to Brittney. Don't mind my room. It is a mess. So you're going to come over with me. Say hi, Brittney. Say hello. She's like, what the hell are you doing? I'm trying to rest, woman. And you're over here bothering me. Jeez. Love you, puppy, puppy. I love you. She goes, get that damn camera off of me. That's my life. That's what I do. Torment the animals by giving them loves. Yeah. But anyway, I know it's a little long video and it's just a lot of information that passing along for today. So my next appointment is until the 13th of August. I have 2 appointments that day. I have an appointment with my nurse practitioner again, and I have an appointment with my urologist. So the urologist appointment I think is going to be just fine because I have a transplant and I don't smell like ammonia, so I think we're going to be okay. As for the hernia, I have a feeling they're going to keep an extra watch on that for me, and I'm going to keep watching it as well too. So if something happens, I have to hightail it up to Rochester and get that taken care of. So, which I have to say, they do fantastic work, and I'm very, very thankful for this transplant. I'm thankful for the family that donated the organ to save my life. So I know they didn't have to, and I'm sure they're probably still grieving, but I am thankful, and I get to continue living. I get to see my kids. I get to see my pets. I get to look forward to things in life again that I wasn't able to do for so long because I was so tired and so fatigued. And my God, I, yeah, yeah, that was bad. I take it a certain little fur dog would like to go out. So better hop off here. But you guys have a good day.